everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board-certified rheumatologist and an obesity medicine specialist. Today, I'll be talking to you about an interesting but complex case of rheumatoid arthritis complicated by Sjogren syndrome, chronic liver disease, who presented with iritis or inflammation of the eye. This is a 66-year-old female who has been struggling with autoimmune disease for last 5 years. She had rheumatoid arthritis, initially presented with joint pain, swelling, and stiffness that progressed to develop salivary gland involvement and secondary Sjogren syndrome, which is dry out and dry mouth syndrome. This disease can be very severe and complicated, and unfortunately, because of lack of proper treatment and difficulty obtaining consults with a rheumatologist, she ended up having an inflammation of the eye called iritis. By the time she came to me, her eye had been very severely affected. She was already seeing a ophthalmologist. Now, when patients come to rheumatoid arthritis specialists like rheumatologists, we look at all the body organs to make sure what other parts of the body are affected. As my workup was going on, I found out that she has liver cirrhosis from being on NSAIDs, and alcohol excessive use led to liver cirrhosis, and now she's in chronic liver disease. And that complicates the situation. So let's talk a little bit about this case and what happens. So rheumatoid arthritis is an autoimmune disease. It affects your joints, it affects your skin, it can affect your internal organs like your lungs, kidneys, but it also can affect your eyes. In this case, the patient's autoimmune disease attacked her eyes, and it's called iritis. Now, sometimes patients can present with iritis even before they present with rheumatoid arthritis. This case, patient already had joint pain, already had secondary Sjogren syndrome, but she developed on top of it iritis. Now, this patient is going to be in chronic treatment protocol. Now, what should we do for this case when the patient has complications of internal organ involvement like eyes, and these are important to say. And number two is patient has chronic liver disease. How do you tolerate it? So the workup that I discussed with her is as follows. I want to treat her arthritis and Sjogren syndrome with medicine that can slow the immune disease. I need to use a disease-modifying anti-rheumatic drug. In this case, ideal would be to take methotrexate, but unfortunately, because of her liver disease, I cannot use methotrexate. I decided to proceed with a medicine called hydroxychloroquine, mildest form of anti-rheumatic drug, but still valuable in our armamentarium. This medicine is an anti-malarial old medicine, has many benefits, and we started as 200 milligrams once a day for 1 week, and then 2 capsules of total of 400 milligrams daily. She'll start that medication. I usually check glucose 6-phosphate dehydrogenase for making sure that she has a low risk of developing hemolytic anemia from this medication. As you know, hydroxychloroquine is an anti-malarial, and when they were used initially, they caused retinal toxicity. So we need to make sure that the patient does not have retinal toxicity. She'll be going for yearly eye exam. Fortunately, she already established care with an ophthalmologist, so that shouldn't be a problem. Second is, what should we do? Should we use prednisone? Yes, we can use prednisone, but since her joint pain is not really high, I decided to give her just 5 milligrams of prednisone for now to see if it would be enough for her. And number 3 is we started workup for biologic therapy. Why do we need a biologic therapy? Well, we understand that rheumatoid arthritis is an aggressive disease. It responds better to biologics. Disease progression, joint damage is much less, but it also is valuable when we already have target organ involvement. In this case, eyes, iritis. So I would be helping this patient with use of medications such as biologic anti-TNF agents. Now we have a long list of anti-TNF agents which have been approved for rheumatoid arthritis, started with infusion medicines like Remicade and Simponiaria. We also have sub-Q injections like Enbrel, Humira, we have Cimzia, and this list of medication I went over with her, and based on that I need to make sure she has a quantiferon TB test negative. I want to make sure she has hepatitis screening negative. I understand that her hepatitis chronic liver disease is not due to hepatitis infections such as virus, Hep B or Hep C, but because of chronic use of NSAIDs and alcohol. And by the way, while we are on the topic of chronic liver disease, I have to mention that unfortunately I have seen rise in chronic liver disease. Why? Because a lot of people have been consuming processed food that leads to increased risk of liver disease, and I have created video on NASH, which is the non-steatotic or non-alcoholic liver disease, and that is something that you should watch sometime. So in this patient, I will be ordering labs for quantiferon gold test, hepatitis screening for viral hepatitis. I will be checking her labs, complete blood count, CBC, electrolytes. I will be checking her inflammatory markers, and I would be starting her on hydroxychloroquine. I'm gonna have her come back within 2 to 4 weeks to reassess these labs, and we initiated the discussion on Humira, which is a biologic medicine. Anti-TNF agents, they are very effective for the medication, but they do carry their risk. In this case, I told her that there's a risk of infection, so if there is an infection, she has to stop the Humira. Number 2, I would also recommend that we check yearly TB testing. Number 3, we have to monitor for screening for non-melanoma skin cancer, where there's a slight increased risk of those cancers. In this case, what I'm trying to inform you that when a patient presents, they may have not only have autoimmune disease, but they also have comorbid condition that a knowledgeable board-certified rheumatologist or an expert physician in autoimmune diseases can help these patients. But this was an important topic that I wanted to bring to your attention: how to deal with a complex patient with an autoimmune disease like rheumatoid arthritis, which is complicated by secondary Sjogren's syndrome, which came into play, causing dry mouth, dry eyes as a result of overwhelming inflammation, and now she has iritis, inflammation of the eye. In all of this, with the background of liver cirrhosis, it is a tough case. So I will be watching her carefully, and I wanted to share with you this learning opportunity, this learning case. If you like this video and you think that this is valuable, please like this video, subscribe to my channel so I see that there's a feedback, that I can find time in between my busy schedule of patients, but continue to share with you knowledge that may help you or your loved ones. Again, whenever it comes to autoimmunity, you can reduce the risk of inflammation by healthy living, anti-inflammatory diet, anti-inflammatory lifestyle, and trying to control your stress level at lower, improving your food, nutrition, and your sleep. I hope this was helpful. I'll see you in the next video.